the difference between two shoulder injuries, right? So what was your question exactly?
That how is it that you can have the same injury, both are rotator cuff tears, yet they present totally different.
Okay, all right. So how can you have two people who have the same injury but present completely differently, right? And most people just tell you, well, people just present differently, right? So everyone's different, and your question is, you want to know why they're different or how they're different?
So I guess a little bit of like.
Okay, a little bit of both.
Yeah, a little bit of both, but more so like, how? Like, why is it that
how they're different? Yeah.
Different.
Yeah.
Is it just the fact that maybe the tear was on the tear's minor?
Yeah.
And the other one.
Yeah. It could, right? Yeah. So
that plays a role.
So right. So with rotator cuff tears, just as with any other injury, everyone presents pretty differently, and sometimes it's something that you just can't see underneath, right? So when someone tears their rotator cuff tendon, you have to wonder, was the injury traumatic? Did they fall? Did something hit them? That kind of stuff. Were they lifting something? Were they pushing something? Were they pulling something? Was it really heavy? And it was a traumatic tear. Or did they have a tear that was just cut over time? After the age of 40, you have a lot of wear and tear on your shoulders. So you've been using your arms and your shoulders your whole life. And usually after the age of 40, they say, is when people are going to start to have, their rotator cuff issues will start to surface a little bit due to, wear and tear over time, right? So we have two patients right now, and they're both completely different, right? And you have to kind of problem solve through how they're different, why they're different, and then really at the end of the day, what to do because they're different, right? So those are the main things. So how they're different, well, you can have a partial tear or you can have a full tear, right? So you can have a partial tear where they maybe tried therapy and they had some prehab, right? But it didn't work, so they weren't getting the results that they hoped for, so they decided to go for the surgery. If you have a full tear, how long did they wait, right? Did they wait a long time? Was there a huge gap between their injury and when they got the surgery or when they got the therapy? So is it a partial tear? Is it a full tear? How long ago were the injuries? Did they have therapy before? Did it work or didn't it work, right? So these are all kind of before. And then you're wondering, how much motion did they have before? Were they somebody who had a ton of motion before, that they had full motion, but they were just weak, they had pain, that kind of stuff. So those are the things that you're kind of wondering. If it's a partial tear, they might repair it with one anchor. If it's a full tear, they might have to repair it with two anchors. Did they tear one tendon or did they tear two tendons, right? So majority of the time, all the tendons kind of come together in the same place. Majority of the time, it's the supraspinatus that's torn. That is the most common rotator cuff muscle to be torn. So there are all of those ones that get torn. So is it a partial or is it full? It depends on the type of surgery you get. Now, with the two that we had, they had two different types of surgery. One had a patch, which is a new technique, which allows active range of motion faster, right? And then one had surgery with two anchors, where the range of motion and the start of therapy can be a little bit slower depending on the protocol of that doctor. So most general protocols are like first month is passive, first month is active, and then second month you're starting to stretch. You need to go to the bathroom?
We can stay, don't worry.
No, it's okay. So when he, whatchamacallit, so that's usually the technique of it is different too. Outside of the technique, then you also have to wonder, the quality of the person's tendon. So some people have better quality tendon than others. Now that varies from person to person.
Yeah.
Depends on how much wear and tear there was, how active or how their tendon, the quality of their tendon is. Like, we don't always know, we don't always have control of that, right? These are all like internal things or pre-us. But if you have an understanding of like where they were before, it can help you to understand why they're coming and presenting so differently. So I have one person who had the patch, and he started in his therapy, I believe 5 days after. You can pass. He started 5 days after his surgery, so he had the patch, and we started to do some active range of motion right away. So he's somebody who's coming in, and he has very little, he had a lot of pain at the beginning, but he started to, calm that pain down, and then he was able to start moving. So pain definitely has something to do with it. He's quite proactive. He does everything he's supposed to do, right? He's very careful too, right? So it's his person, it's his personality. He was compliant. He comes as many times as he's told to come and all this stuff, right? He's also been getting like additional therapy services somewhere else that's doing the electrical stim, right? So he's getting a ton of stuff. And then we have somebody who came in, and she is a rotator cuff, and she's got 2 anchors, right? She had a traumatic injury, and after her surgery, she went away for a few weeks and didn't start therapy. She didn't start therapy until 3 weeks post-surgical, right? And then she was told to stay in a sling. She had the E7 machine while she was gone, so that kind of helped her calm her pain down. But she was also told not to move. She was told not to move, and supposedly she didn't, but she did stuff, right? Where in her mind, she didn't do much. But we don't know what it was, but she supposedly took it easy. She didn't really have much pain. So because she didn't have any pain, she thought, oh, well, everything is fine. But now coming into therapy, she's not coming as often, and she's pretty tight, So yes, everyone is different because the quality of the tendon is different. How they did before the surgery is different. Maybe the technique is different of the surgery. When they start, it might be different. But people's body and healing and stuff like can be different too. People's mindset can be different. If you're someone who's more afraid, more timid, more careful, if you're apprehensive about moving and that kind of stuff, that might, kind of slow you down a little bit. Versus if you're a lot more knowledgeable, or you're careful but not too careful, you can move a little bit more. So there can be a lot of different reasons why someone who has supposedly same exact injuries and surgeries can present completely different. You just have to understand why, these little nuances, why they're different. Really, at the end of the day, you're trying to understand how they're different, so you can take them at whatever level they're coming to you, and then you're going to progress them and progress them and progress them, right? The person who's coming to us a little bit late, she's making pretty good progress. Now she has a complication that's slowing her down a little bit. So her anchors have loosened, and so now she's kind of fearful of moving. She's allowed to move, but at the same time, it's like, well, if I move, how much will I move? How bad will it make it? Whereas someone who's, feeling good gets to continually be reinforced by the fact that he continues to feel good, continues to move, and he's making pretty rapid process. So you're making pretty rapid process, you're going to keep wanting to go, right? And when making slower progress, it makes it really hard for them to keep going, because it can be quite depressing. It can be quite debilitating to not be able to make that progress as fast. And what's funny is the person who is not progressing as well is actually the most active person. So it doesn't necessarily have anything to do with how active or fit you are. It can be all these different things, but all these different nuances, all these differences is what makes the difference of like how they're doing and how they're presenting and how they're progressing or lack of progressing. Hey therapy friends, it's Huang here. Thanks again for watching my video. And if you like videos like this that can help you just crush it in the hand therapy world as an occupational therapist, then hit the subscribe button and enjoy the video. Thanks again for watching.